Hi everyone. This is the 10th and the last behavioral health lesson in this series. Today we're going to talk about psychological disorders, their treatments, prevention, identification, recovery, and wellness, stress, and coping. So, to have a psychological disorder, a syndrome is characterized by significant disturbances in cognition, emotion, behavior that reflects dysfunction in psychological, biological, or developmental processes of a person's mental function, and it's studied through a thing called abnormal psychology. Abnormal behavior is one that is not usual, and the first step to identifying abnormal behavior is observing a difference between this person's abnormal behavior and what is considered normal behavior. Now, let's take an example. Intellectual disability is when someone has an IQ of less than 70. This statistical approach is slightly problematic because cultural specificity means IQ is not universally applicable across all cultures. Some cultures just might inherently have a lower IQ score because of the way it's tested. It's too rigid and pretty harsh as well. For example, someone that has an IQ of 71 is not intellectually disabled, and someone that has an IQ of 69 is. Now, comorbid is a term that means that there's more than one disorder at the same time, which means you can't just add up the proportions of all the disorders in the planet and hope they add up to 100%. Actually, comorbid disorders happen frequently. To be diagnosed with a psychological disorder, you need to base that diagnosis off of observable behavior. Professionals refer to the Diagnostic and Statistical Manual of Mental Disorders, and the most recent edition is the text revision of this TSM-5. Now, more perspectives of psychology leads to better understanding of factors leading to this disorder, which means the better understanding of a course of treatment. Early disorders are typically classified as neurodevelopmental, which are diagnosed in childhood and occur through the lifespan. For example, autism spectrum disorder is related to bad social relatedness and communication skills with repetitive ritualistic behavior. There are genetic and environmental factors, and they are not correlated with vaccines. I found it amusing that the textbook mentioned this. Now, there's also attention deficit hyperactivity disorder, which is unusual inattentiveness or hyperactivity with impulsivity or both. There are genetic and environmental factors, for example, low birth weight, prenatal exposure to drugs, and underactive frontal lobes. Schizophrenia is where there's hallucinations, delusions, disorganized thought and speech, movement disorders, restricted affect, avolition, which is a significant decrease in initiation, motivation, and goal-directed behavior, or asociality, which is a lack of motivation to engage in social interaction. It's prevalent in 1% of the population. Delusions are false illogical beliefs. There's also disorganized and abnormal motor behavior involved with a genetic vulnerability to this. There's an overlap of genes in schizophrenia and bipolar, leading to comorbidity. Now, there's extreme stress, right, in the environment, and this can increase the appearance and severity of schizophrenia in genetically predisposed people. For example, it's 5 times more likely in lower socioeconomic groups due to the stress of living in poverty, and there's also environmental influences like the prenatal environment. Bipolar is where there are altering periods of mania and depression. Mania is an unrealistically elevated mood, and it affects 2.6% of American adults. There's a genetic predisposition, and diet interacts with genes, right? And omega-3, which is found in fish, fight against bipolar disorder. Interestingly, bipolar is more prevalent in people who are artistically creative. Major depressive disorder. This is characterized by lengthy periods of depressed mood, loss of pleasure in enjoyable activities, disturbances in sleep and appetite, difficulty concentrating, hopelessness, and even suicidal thoughts. 7% of the adult population each year is diagnosed with major depressive disorder, and the age range and the prevalence in the age range of 18 to 90 to 29 years old is 3 times as high as those who are 60 or above. It's also more prevalent among women rather than men. We can explain depression using the learning, social, cognitive, and the strictly biological approaches, right? For example, take learning. If there is a reduction in positive reinforcement or learning in negative or increase in negative outcomes, then you can become depressed. Negative thoughts about the self, the world, and the future can also lead to major depressive disorder. There's this term called learned helplessness, which is experiencing random and uncontrollable consequences which lead to helplessness. Several genes are involved, including those affecting serotonin levels. We'll get to this later, but serotonin is one of the things that are most targeted by medicine in order to alleviate MDD. Severe stress usually precedes an episode of depression, and biological dispositions again can interact with cognitive patterns and life events. Anxiety disorders are cases in which anxiety is not proportional to the circumstance, right? And maybe there's a strong and negative emotion associated with it, as well as a physical tension because of this anticipation of danger. There's 30% of Americans which experience anxiety disorders, but it doesn't actually impair your ability to think reasonably. It's separate. It's a completely biological response. A specific phobia is a fear of objects other than those associated with agoraphobia and social anxiety disorder. I'll explain those now. So social anxiety disorder is an unrealistic fear that is more prevalent in collectivist cultures of being among a group and socializing, right? Agoraphobia is fear of open spaces after the Greek word agora for marketplace. And panic disorders are repeated panic attacks, as well as the fear of future panic attacks. Panic attacks themselves are intense fears and autonomic arousal that arises from it. Generalized anxiety disorder is where there's excessive anxiety and worry for 6 months that is not correlated with specific objects or situations, and that's a very significant problem. From the social perspective, lower socioeconomic class in the US is twice as likely to be diagnosed as those in upper and middle classes, which means that anxiety is most likely to occur in individuals with, and also anxiety is most likely to occur in individuals with high reactive temperament because of their genetic background. Next, we will talk about obsessive compulsive disorder and related disorders. Obsession is where there are intrusive and distressing thoughts, and compulsions are repetitive ritualistic behaviors associated with high anxiety. Obsessions are distinct from everyday worries, which focus on real-life problems. There's a strong genetic vulnerability, and symptoms of OCD may arise following head trauma. From the learning perspective, we can explain OCD by saying that for some reason, this patient has made a connection between compulsions and rewards. Culture plays a role in how frequently OCD occurs and what obsessions and compulsions are more likely. Body dysmorphic disorder, which is very closely related, is an unrealistic perception of physical flaws. PTSD, post-traumatic stress disorder, is unique because it is the only one with a specific cause, experienced trauma. Symptoms include hypervigilance, avoidance of stimuli related to the trauma, emotional numbing, re-experiencing the trauma through intrusive thoughts and flashbacks or even dreams. It affects 3 to 4% of the adult population, and there's lower levels of naturally occurring benzodiazepine in the frontal cortex. Conditioned responses to stimuli associated with a traumatic event is what causes the PTSD, and social as well as cultural factors are related to its development. Dissociative disorders are where there are disruptions in a person's identity, memory, or consciousness. It can take several forms. On one level, we have dissociative amnesia, where a person forgets important information about specific events that they've been to. Depersonalization or derealization disorder is where a person experiences strong feelings of unreality about the self or the surrounding environment. It's like they're living in a simulation and they're separated from the actual world. This associative identity disorder is where you actually switch identities, and it's described as possession by other identities inside the head. By this description, I'm sure you can deduce that the treatments for dissociative identity disorder and these dissociative disorders in general are quite controversial. Somatic symptom disorder are where there's a physical symptom with no medical cause, and the patients often spend excessive amounts of time thinking about the seriousness of their symptoms, and it can be accompanied by high anxiety. The patient thinks that the symptoms are serious and disabling. For example, it can range from vague pain complaints to gastrointestinal upset, sexual problems, amnesia, breathing problems, or unexplained sensory or motor problems. Now, personality disorders are characterized by impairment in identity, personality traits, and establishment of empathy and intimacy. Antisocial personality disorder, abbreviated ASPD, is a pervasive pattern for disregard for and the violation of rights of others. It's similar to psychopathy. The cause is mainly genetic with an abnormal orbitofrontal cortex. Now, for borderline personality disorder, this is expressed in instability in interpersonal relationships, self-image problems, and problems with managing emotion. And it's caused when traumatic experiences interact with genetic predispositions. Narcissistic personality disorders involve grandiosity, need for admiration, and lack of empathy. And there's two types: a grandiose narcissist who has inflated views of self-worth with aggressiveness and dominance, and a vulnerable narcissist which has inflated views of self-worth with insecurity, defensiveness, and negative emotions. Next, we'll talk about treatments. Clinical psychology recognizes the advantage of integrating psychological perspectives in order to understand behavior and mental processes. And this is where psychological and biological treatments overlap and both help with these disorders. There are various categories of therapy, though. For example, psychotherapy is designed to improve the symptoms through conversations between the therapist and the patient. Counseling is closer and is more closely linked to humanistic therapy nowadays, where you focus on the personal strength and the development of the patient. It now refers to treatment for adjustment problems, though, right, in terms of counseling specifically, as opposed to treatment for severe psychological disorders. And as you'll learn in the last section, what do I mean by adjustment? It's where a significant change in someone's life can cause a great amount of distress. Now, evidence-based practice is a combination of personal experience of the clinician, the best scientific evidence, and the consideration of patient values and their own expectations. It's tailored to the individual patient. There are various categories of therapists. A psychotherapist is a licensed professional who provides psychotherapy. Psychiatrists are doctors of medicine specializing in psychiatry, so they can prescribe medications to treat psychological disorders. Psychologists have PhDs and PsyDs, which is a professional doctoral degree necessary for becoming a psychologist, and clinical psychologists must complete supervised internship. A counselor is a professional with a PhD, a PsyD, a Doctor of Education, or master's degree who specializes in problems with adjustment. Delivering psychotherapy. It's rather a brief time frame with 3 to 5 sessions. There's also group therapy with 6 to 12 people. Right, so brief is its own category. Group therapy is another category. Now, family is where the family members participate individually and in combination with other family members. And couples therapy is a type of family therapy that focuses on intimate relationships. There are various contemporary challenges in treatment because they have become managed by large organizations, let's say insurance companies, for example, rather than individual professionals in small private practices. Historical psychotherapy approaches, which have since become rather obsolete, include insight therapy, which improves symptoms by building people's understanding of their situation through the psychoanalytical model. Psychoanalysis, which was developed by Freud, practiced by those who believe in psychodynamic theories, which is a type of insight therapy. Free association is a psychoanalytic technique of encouraging the patient to say whatever comes out of their mind without any censorship. Transference is where the therapist uses the responses of the patient to whatever the therapist is saying to understand the patient's approach to authority figures in general. For example, they could thank the therapist for helping them solve all of their issues, right? And that would indicate to the therapist uh, the type of ways this person treats authority figures. Now, resistance is where a patient is reluctant to accept the interpretations of the therapist, right? The therapist might propose an idea that might be the root cause of this patient's issue. If the patient disagrees or tries to deny it, then to a psychoanalytic therapist, that means their interpretation is most likely correct. Person-centered therapy is humanistic and it's developed by Carl Rogers. Clients achieve congruence of alignment of the real and the ideal selves. At least that's the optimal goal. There are various contemporary approaches, right? So we have behavioral therapy, which combines classical and operant conditioning to treat systems of psychological disorder and adjustment problems. Cognitive therapy adjusts how we think about bad thoughts and how we adjust those bad thoughts. All right, so that would be cognitive restructuring, which replaces earlier irrational beliefs with new rational beliefs. Cognitive behavioral therapy combines both of those and restructures the thoughts of the person while incorporating behavioral treatments to reduce the symptoms, right? Take agoraphobia. If you expose a person to a crowded place in order for them to get used to it, while also rewiring their mind to accept the fact that there's nothing inherently dangerous with open spaces, well, then their agoraphobia might improve. The biopsychosocial approach is an integrated therapeutic approach which combines the biological, the personal, and the societal factor and the social factor of disorders during treatment. Now, biological therapies specifically, we can have medications, which has a stronger preference in younger patients as well as women. Electroconvulsive therapy is only used for severe depression that doesn't respond to other treatments. You anesthetize the patient, give them a muscle relaxant, and then electricity is applied via electrodes on the head to induce general seizures and change the brain chemistry. Psychosurgery is where you try to improve the symptoms by physically operating on the brain. Deep brain stimulation is electrical stimulation applied via surgically implanted electrodes to treat anxiety and mood disorders. Neurofeedback is a type of learning conditioning, which teaches the patient to keep measures of brain activity within a certain range, and it's used to treat ADHD and seizures, because if the person is rewarded for being able to keep their brain waves, their brain activity at a certain level, then they will not accidentally get into a position where they might have a seizure. This is just a summary of what we've talked about for the past 18 minutes. Take a look at those if you would like to. Now, prevention, identification, and recovery. There are a few campaigns and organizations related to this, which you will need to memorize because the exam will indeed be able to sneak a few multiple choice questions about these organizations into the exam. So the Talk, They Hear You campaign has a goal of reducing underage drinking and substance abuse for youth under 21 years old. The Interagency Coordinating Committee on the Prevention of Underage Drinking has a goal of coordinating 15 federal agencies to develop a comprehensive plan to combat this issue. They have a website called Stop Underage Drinking, which has research, federal and state resources, funding opportunities to reduce and prevent underage drinking, and much more. National Prevention Week, which is in May, has a goal of promoting community involvement, resource distribution, and partnerships that increase public awareness of substance abuse and other mental disorders. Communities Talk to Prevent Alcohol and Drug Misuse is a national initiative that provides resources and stipends for community-based organizations, higher educational institutes, and statewide organizations. They focus on advocacy, raising awareness in youth. National Children's Mental Health Awareness increases public awareness of needs of children with serious mental illness and emotional disturbance, shares initiatives that promote positive development, recovery, and resilience. The Federal Commission on School Safety recommends policy and best practices for school violence prevention, and the National Child Traumatic Stress Initiative, abbreviated NCTSI, raises awareness about the impact of trauma on children, and they propose interventions to reduce the impact of traumatic experiences. Now, biological approaches to therapy. We've already talked about this, but interestingly, it was covered in both chapters. And again, you have medication, electroconvulsive therapy, psychosurgery, brain stimulation, and neurofeedback. Now, treating ASD is accompanied by abnormalities in serotonin, which is the happy chemical, GABA, the inhibitory, and glutamate, which is excitatory. However, no medication that manipulates these have been found useful. So now the most commonly used treatment is applied behavioral analysis. This relies on the principles of operant conditioning, and instead of targeting the root cause or the chemical imbalances, they focus on observable, socially important behaviors like communication, with the intention of producing lasting results that can apply to settings outside therapy. Treating ADHD does involve medication, and it's often in combination with behavioral therapy for children. Ritalin blocks reuptake of various hormones like dopamine and norepinephrine by inhibiting the transporters, whereas dextrin and Adderall do that, but they also increase the release of those hormones by entering the presynaptic neurons and then causing those neurotransmitters to be released. The main idea is that hyperactivity occurs if areas responsible for planned thoughtful behavior and attention are not active enough. So obviously you want to trigger more of these neurotransmitters to be released. Treating schizophrenia involves phenothiazines, which reduces psychosis. They are dopamine antagonists, and however, nearly 25% of patients do not respond to these drugs. They reduce psychotic symptoms, but they're less effective at reducing the negative symptoms such as social withdrawal and emotional disturbance. By negative symptoms, I don't mean bad. I mean where there is a lack of something, right? A lack of socialization, a lack of emotion, right? So those are the negative symptoms which this medicine cannot help with alleviating. There's actually side effects of tardive dyskinesia as well, which is where there are tremors and involuntary movements, especially in the face and tongue. This is due to the lack of dopamine. It's mostly treated with medication, however, other treatments can offer help. For bipolar disorder, the primary method is also medication, lithium carbonate, which increases the calm neurotransmitter. It decreases dopamine and glutamate, which are alleviated in mania states. However, there are yet, again, unpleasant and potentially dangerous side effects. Toxic levels produce nausea, vomiting, muscular tremors, seizures, and comas. Therefore, the patients have to have regular blood tests to monitor lithium levels. Most individuals require medication, and psychotherapy alone is not typically considered. Treating major depressive disorder. There are very diverse treatments due to the range of causal factors in depression. They range from medical to cognitive to behavioral to simple aerobic exercise, and various methods are often combined for the best results. However, the most popular method today is medication. SSRIs, which selectively inhibit the reuptake of serotonin, leaves more serotonin, happy neurotransmitter in the synapse. Many alternatives are also successful and have the benefit of no side effects. So now one of the most popular approaches for therapy is cognitive behavioral therapy, which we've already talked about, and we'll give dialectical behavioral therapy an honorable mention, which tries to regulate emotions, relationships with other people, and copes with distress. So it helps the patients in those aspects. Now, in order to treat anxiety disorders, like general anxiety, phobias, and panic disorders, you usually use medication and cognitive behavioral therapy. The main idea is that anxiety is heightened during is heightened brain activity due to anticipated danger. So if you can tranquilize the brain, then you can reduce its activity and reduce the amount of physical tension in the body. The common method is to enhance the effects of GABA, which is inhibitory toward these neurotransmitters. Although these drugs are used, antidepressants are often more effective, and study and it suggests that there is an underlying cause for both depression and anxiety. I apologize. Now, treating OCD. You usually treat it with antidepressants, cognitive behavioral therapy, or a combination. It trains people to anticipate convulsive behaviors and then engage in a competing behavior. And meta-analysis shows that CBT is highly effective. It's also highly effective for body dysmorphic disorder because it helps people think realistically about their perceived flaws and how these perceived flaws are actually not flaws and that their ideal state is actually unobtainable and destructive. And yet, many individuals insist on continued treatment by cosmetic surgeons and resist obtaining psychotherapy. We treat PTSD through exposure therapy or selective or serotonin reuptake inhibitors. Many people with PTSD develop additional substance use disorders, which means that some other treatment for those issues are also necessary. Somatic symptom disorders include have biological and psychological treatments, right? We target physical symptoms such as pain that have no apparent basis. The most effective treatments are antidepressants as well as physical activity. Treating dissociative identity disorder. The treatments and even the diagnosis itself is very controversial. Some therapists work based on the assumption that it's a valid diagnostic category that often results from serious trauma and, in particular, childhood sexual abuse. The treatment is aimed at integrating the various personalities by identifying and working through the traumatic memories. Right? So, slowly, if you can get the various personalities to acknowledge the existence of one another, that is already a very significant step. So, it's not like one is just entirely taking over. Now, hypnosis is sometimes used to assist in recovery and resolution. However, it's not well advised. People may be vulnerable to manufacturing false memories under hypnosis, which makes this rather ethically dubious. To treat antisocial personality disorder, um, there are no known effective medications. So what we do instead is just tranquilize them, right? If they do something very questionable or violent, we tranquilize them, or or the antipsychotic drugs or anticonvulsant convulsion medications for the same reasons. So that's why it's so high priority to treat this disorder because individuals in this category often inflict harm upon the rest of society. Individuals themselves that have this disorder tend to view themselves as okay and not in need of treatment, which is why it's actually so tricky to navigate. But the models right now are learning, right? And they emphasize the development of the capacities to control anger, social skills, and moral reasoning and increase moral reasoning. To treat borderline personality disorder, there are no known medications, but they're often prescribed. And these include antidepressants, antipsychotics, mood stabilizers, anti-anxiety, or anticonvulsants. Now, what I mean by prescribed, I mean like they're given by the doctor on a case-by-case basis because there's no general consensus about one medicine that could alleviate the symptoms. It's often treated with cognitive behavioral therapy instead, which teaches individuals to manage stress, emotions, and relationships, and it also reduces suicidal thinking and behavior. Actually, dialectical behavioral therapy was literally created to address borderline personality disorder. The main focus of treatment is in order to reduce suicidal thoughts, to reduce behavior that interferes with therapy, and to reduce behaviors that interfere with the quality of life. There are four major dimensions of recovery: improving physical health, right? For example, abstaining from alcohol, drugs, or non-prescribed medications, right? If you're going through an addiction and you want to get over the addiction, that would be the health dimension. The home dimension is making sure that the patient has a stable and safe place to live while they recover. Purpose is where the patient has meaningful daily activities to be independent, earn income, and participate in a society. Community is the dimension of having relationships in order to have the support system, right? Friendship, love, and hope, which grounds the patient. Finally, we'll talk about wellness, stress, and coping. Stress is a fact of life, but it can have a genetic predisposition for a dramatic degree of responses to stressors. What is stress? It's an unpleasant emotional state from the perception of danger due to stressors, which are highly individual and idiosyncratic. There are positive outcomes of our responses to stress. It motivates us to perform well and makes us healthier in the long run, but again, it can also be very counterproductive and interfere with performance and well-being. Extreme cases are those disorders that we've been talking about, right? Depression, schizophrenia, PTSD. Now, what is the physical stress response? Very cold, you have a lack of oxygen, emotional experiences, right? All of these things, they can all have the capacity to initiate the fight or flight response, which is the stress response. Your heart rate, your blood pressure, and your respiration all go up. Non-essential functions are inhibited in order to save resources and energy. And physical responses reflect this process, which has been finely tuned through evolution in order to maximize survival in emergency situations. This researcher called Hans Selye made a study and he studied the effects of longer lasting stressors using rats. He exposed them to a variety of stressors and measured the amount of time they should swim before giving up. Right? Okay, so if you're very cold, then there would be restraint, and then electric shock, and then surgery, and then having their whiskers cut off. They all reduced the time the rats would swim before giving up. And regardless of the stressor, the rats responded with a consistent pattern of behavior, which is called general adaptation syndrome. Now, there are three stages, right? One is when you have the stressor and all the resources are mobilized for fight or flight. If stress is prolonged, then we enter the resistance stage. You're trying to cope and you're trying to adapt and you're trying to prolong this fight or flight for as long as possible. And then in exhaustion, your resources are depleted. And this is a chart which visualizes that over relative time. Now, there are various sources. Cognitive appraisal models help predict whether a particular stimulus or event is likely to be a stress for an individual person. We make appraisals, everyone does, which are rapid assessments of things that could make you stressed to determine whether they are irrelevant, harmless, or positive or negative. People appraise situations from their own point of view, and so you should expect that, therefore, a single potential stressor might produce different amounts and intensity of stress for different people. Despite variability in response to stressors, we can identify several types of events that are likely to produce significant stress. One are large-scale disasters. Two, significant changes in life, right? And three, relatively insignificant sources of stress, which are called hassles. Now, how's the amygdala involved? Well, it participates in a fear circuit that provides a rapid assessment of a stimulus or situation as potentially dangerous. And once the amygdala has identified this, it communicates with the hypothalamus, which most directly commands the autonomic nervous system, known for the fight or flight, or the other way around, flight or flight. And so you can have conditioning, right? So you have the unconditioned pathway, and you shock the rat. The thalamus will send it to the somatosensory cortex, because it'll send it to the amygdala. But then you have the conditioned pathway. If you pair the shock up with a tone, it'll also eventually be sent to the cortex, which will send the cortex related to the sense, which will then send it to the amygdala. And now, not only will the rat be traumatized, as they should be, by the electric shock, they will also be traumatized by the tone that is paired with the electric shock. There are two systems involved: the hypothalamic pituitary adrenal axis, which is slower, and the sympathetic adrenal medullary system, which is much faster, right? The second one just kicks in immediately, very closely related to the fight or flight response. There are also gender differences in terms of stress. Women are more likely to befriend people in response to stressors. As in, for women, stress is more associated with the release of oxytocin, which is actually a hormone related to social bonding. It relieves stress in animals only when the animals are in a social group, right? So for us humans, it would make sense that people would want to befriend other people if they are stressed. Social economic status can also cause differences in stress. Lower SES, more noise, more toxins, carcinogens, violence, a lack of resources or less healthcare, higher levels of substance abuse, less exercise, more anger, less emotional control, less trust, right? All of these factors are associated with high stress, and they are all related to a lower social economic status. Now, let's take a look at how stress influences the immune system. Stressful memory task participation was correlated with an improvement, a temporary improvement in the immune system response. They measured that using chemicals in the saliva of the participants. However, if the immune system faces long-term chronic sources of stress, then it will struggle to fight back against illness, and they're also more vulnerable to infectious disease like colds. Why? Because lymphocytes, which protect us from invading organisms, are suppressed when there are stress hormones present. Now, heart disease. These guys named Mayer Friedman and Ray Rosenman did a bit of research, and what they did was actually after they proposed their idea, they triggered lots of research from other psychologists as well, because they wanted to prove these two people wrong. And what was their proposal? Their suggestion was that highly competitive workaholics, which we'll call type A personalities, were more susceptible to heart disease than mellower, laid back people that they called type B personalities. Further studies showed that competitive personality had nothing to do with increased heart disease, but they were in some ways quite close. The type A people who did develop heart problems exhibited a pattern of interpersonal hostility. Stress puts cardiovascular system at risk because it affects the ability of the blood vessels, to expand when necessary. Yeah. How is stress interrelated with mood, sleep, and obesity? Long-term stress is bad. It disrupts our sleep, and yet we need sleep to restore our bodies after the challenges of the day. Now, cortisol, which is the stress hormone, also plays a role in maintaining our natural cycles of sleep and waking. It's released in large quantities in the morning in order to allow us to wake up faster. They will drop off eventually during the evening, which reduces wakefulness and sets the stages for sleep. But if you have high cortisol levels when you're sleeping, then you'll have bad sleep and then you won't be able to restore your body for the next day. And high levels of stress as well as depression can produce sleep disturbances. So all of these are related. And you also have obesity, right? Because fat cells actually behave differently in response to stress-related hormones. They go through mitosis faster and they grow in size, like the one single cell itself will enlarge if they are exposed to this cortisol. Now, there's an integrated view of stress and health, right, in all of these support groups, right? Because at the center, right, at the micro level, you have family, school, work, right, stuff like that. And then you have goods and services, transportation, mass media, microcommunications, so stuff like that. And then we get to the macro level, like social norms, political systems, economic systems, culture, education, all of these things which are correlated with health are also factors that influence a person's stress. There are three types of coping. Uh, we've got problem focused, which addresses the problem, solves it, tries to solve it. Emotion focused, which helps you deal with the negative emotions associated with the stressor. And finally, we've got relationship focused, which maintains and protects social relationships in response to stress. The biopsychosocial model, again, is this theory that health is the result of all of these factors intertwined. For example, if you have perceived stress like threats, helplessness, or vigilance, and you have things like environmental stressors and trauma and abuse. Well, then all of these things will have a cycle and they're all intertwined, right? These perceived stressors, individual differences, right? The uniqueness of this patient themselves and their behavioral responses to all of these stressors, right? The environmental stressors, the major life events, and the trauma and the abuse, right? These behavioral responses themselves will all commit and will all contribute to their health outcome, right? They will adapt, they will have physical responses, and then that ultimately results in determining uh, what their health outcomes are. Anyways, that's it for the last lesson. Good luck, everyone, on the SLC. It's just about in a week. I hope everyone has found this. Hope everyone has found these series of videos helpful and glad to support you in your HOSA journey. Okay, good luck, everyone, and thanks. If you have any questions, leave them down in the comments below.